Assalamualaikum. I'm Dr. Amara from MMK Hub. Today I'm going to give the lecture about the ovarian cyst. And the purpose of giving the lecture is that we can make your concepts more clear. Ovary. Normal size of the ovary is 5 into 3 into 3 centimeters. And if we consider it in millimeters, then it would be 50 into 30 into 30 millimeters. Variation in dimensions can result from different reasons, like if there is endogenous hormonal production, it varies with age and menstrual cycle. As all of us know that hormonal effects on the uterine walls causes the difference in sizes and thickness of the wall of the uterus. Exogenous substances including PCOs and gonadotrophic releasing hormone agonists or ovulation inducing medications may affect the size. These are the exogenous substances. These are those hormones which are synthetic hormones and they are introduced externally so that but they can affect the uterine wall and their size. Risk factors of ovarian cyst. The first, infertility, and infertility occurs and it needs treatment. Patients being treated for infertility by ovulation induction with gonadotrophins or other agents such as clomiphene citrate or letrozole may develop cyst as part of ovarian hyperstimulation syndrome. Pregnancy. In pregnant women, ovarian cyst may form in the second trimester when human chorionic gonadotrophic levels are at peak. Hypothyroidism because of similarities between the alpha subunit of thyroid stimulating hormone and human chorionic gonadotrophin hormone. Hypothyroidism may stimulate ovarian and cyst growth. Maternal gonadotropin. The transplacental effects of maternal gonadotrophins may lead to the development of neonatal and fetal ovarian cyst. Cigarette smoking. The risk of functional ovarian cyst is increased with cigarette smoking. Risk from smoking is possibly increased further with a decreased body mass index. Tubal ligation. Functional cysts have been associated with tubal ligation sterilization procedures. Epidemiology. Ovarian cysts are found on transvaginal sonograms, that is TVS, in nearly all premenopausal women and in up to 18% of postmenopausal women. Women develop one or more Graafian follicles each menstrual cycle which appear as cysts on imaging. Most of these cysts are functional in nature and benign. Mature cystic teratomas or dermoids represent more than 10% of all ovarian neoplasms. Functional ovarian cysts can occur at any age, including in utero, but are much more common in women of reproductive age. They are rare after menopause. Luteal cysts occur after ovulation in reproductive age women. Ovarian mass. There are different ovarian masses like functional, inflammatory, neoplastic, and some others. In functional ovarian masses, we have follicular cyst, corpus luteal cyst, and theca luteum. In inflammatory ovarian masses, we have tubuloovarian abscess. And in neoplastic ovarian masses, we have benign, borderline, and malignant. And in others, we include endometrioma, enlarged PCO, paraovarian cyst. Now we will discuss functional ovarian cyst. Follicular cyst, corpus luteal cyst, theca luteal cyst, luteomas of pregnancy, and by far the most common clinically detectable enlargements of the ovary in the reproductive years. All are benign and usually asymptomatic. Follicular cyst. These are the cystic follicle, defined as a follicular cyst of diameter more than 3 centimeters. These are benign cysts and the most common function cysts, and they are rarely larger than 8 centimeters. They are lined by the granulosa cells found incidentally on pelvic examination and usually resolve within 4 to 8 weeks with expectant management. May rupture or torse occasionally, causing pain and peritoneal symptoms. This is the diagram showing follicular cyst. In it we have a cyst which is anechoic, that is the black one with the simple lining, outer wall, the simple thin walled, and it has no stria inside it, and it is adjacent to the uterus corpus luteal cyst. It is less common than the follicular cyst, may rupture leading to hemoperitoneum and requiring surgical management, more in patients taking anticoagulants or with bleeding diathesis. Unruptured cyst may cause pain because of bleeding into enclosed ovarian cyst cavity. This is the corpus luteal cyst, theca lutein cyst, which is the least common, usually bilateral, that is, it is usually found in both the ovaries, result from overstimulation of the ovary by beta HCG, do not commonly occur in normal pregnancy, often associated with hereditary moles, choriocarcinoma, multiple gestations, use of clomiphene citrate, and gonadotrophic releasing hormones analogs. May be quite large, up to 30 centimeter, and it can be multicystic, that is containing different small cysts inside a single large cyst, and regress spontaneously. This is the picture showing theca lutein cyst. You can see very well that there is a large cyst with small cyst inside and covered with the wall. This is a diagram showing theca lutein cyst. It shows enlarged uterus in the center and bilateral theca lutein cyst. The cyst on the left shows a breach in the capsule, and the right cyst with thin hemorrhagic area suggestive of impending rupture. This is the table showing different functional ovarian cysts. These are the features of different functional ovarian cysts, which we have discussed before. And thank you so much. That's all for today's lecture. And if you have any queries, you can contact us on the website and WhatsApp group of NMK Hub.